Welcome everyone, and thank you so much for joining us today at the 2020 virtual Fairfax County Public Schools Mental Health and Wellness Conference and Innova Act on Addiction Summit. This webinar series would not be possible without the generous support of Joan and Russell Hitt. Before I introduce our speaker, here are a few housekeeping notes. All participant lines have been muted and everyone's video has been turned off. We will be taking questions via the Q&A feature and they can be submitted at any time. We will do our best to get to as many questions as we can. Our speaker today is Dr. David Anderson. Dr. Anderson is Professor Emeritus of Education and Human Development at George Mason University, where he worked for 28 years. He has managed hundreds of national, state, and local projects while teaching graduate and undergraduate classes. An active researcher and writer, he has decades-long research on college drug and alcohol issues, high school youth, and community efforts. Take it away, Dr. Anderson.
Thank you, and I'm delighted to be here today. Our session today is blending the head and the heart, resiliency with the pyramid of success. So, there we are. Computer was a little slow this afternoon to saying, wake me up. So I'm delighted to be here and so glad that you're here and taking the time out of your busy schedules. Thank you for all you do. Thank you for all that you are going to be doing. I hope today's session will help give you a little more resiliency, particularly during these tough times that we're all going through as a nation and as a world. As we look at our objectives for this afternoon, I'm going to be introducing something called the pyramid of success that I've been using actually for decades. I hope that you're going to gain some resiliency and get some inspiration from some long-term advocates. I'm a long-term advocate on drug and alcohol abuse prevention, as well as from others that I will be sharing with you, the perspectives of other long-term advocates, and I'll say a little bit more about that. I'm going to be stressing the head and the heart, the head meaning our thinking and the heart meaning what we really care about and a lot of our emotions. This is designed for individuals who, from an individual perspective, a family perspective, a parenting perspective, have some concerns or may want to do more to address drugs and alcohol. And it's also from a, if you will, a leadership or a professional or an organizational perspective. That meaning if you're an educator, a counselor, law enforcement, medical, health, even in public policy. So from both of those perspectives is where I hope to instill some resiliency and even as one of our objective sites, some specific skills. I know this is a limited time for this session. The whole thing is an hour. We will have questions at the end. The slides will be shared afterwards because there's some URLs in there that are way too long. And one of the challenges I must say is in doing something in such a short period of time is that drug and alcohol issues continue to evolve. Drug and alcohol issues are not something that can be solved with a quick fix. If it could have been, we would have done it decades ago. But in my years at Mason teaching a class which was 45 content hours, we still did not get done. So it's an ongoing issue. I hope to highlight, hope to inspire and point you into some new directions. So I mentioned I'm going to focus on something called the pyramid of success. All three of these parts in this pyramid are critical. Competence is essential. We have to have some skills. We have to have a lot of skills in whatever we're doing, whether we're a teacher or law enforcement or in medical. Can you imagine going to a doctor and he or she did not have the latest competence? So competence is important. We also need confidence. We need to believe in ourselves. We need to be strong enough to speak up when we have some knowledge more than those around us, to share that. And commitment means going the extra mile, keeping at it. Sometimes I wonder why I have been doing drug and alcohol abuse prevention for 45 years and still going. Actually, I don't wonder about that, but when things get a little tough, you say, why am I doing this? And again, we'll come back to why that's the case. And all of this is based on a book that I worked on for about a half dozen years and was actually published just a year ago this month. It's called Leadership in Drug and Alcohol Abuse Prevention, Insights from Long-Term Advocates. And what it was all about is it was founded in a conference I went to 7 or 8 years ago, and the speaker told a story. And he says, let me tell you about a story about Bill W. Now, Bill W. is one of the co-founders of Alcoholics Anonymous, and he's told this story. And then he told a story about Dr. Jelinek, who really coined the term, the disease concept of alcoholism 100 years ago. And he said, you know, I can tell the stories because I knew each of them. But who's going to tell the stories when I'm gone? And that hit me like a ton of bricks. It's like, oh my gosh, here are all these people who've been working for decades in drug and alcohol issues, whether in prevention or intervention or treatment or whatever, policy making, what research, whatever. And who's going to tell their stories when they're gone? So I took it on myself to interview a lot of people from all sorts of walks of life, some of those that I've just mentioned. And I interviewed and I asked them all the same questions. I recorded them, and then I had all these quotes, and I had to figure out, what am I going to do with them? Well, you're going to see dozens of them today. And so I put those together in a book, and I invited another 50 people to write short essays on whether it was underage drinking or DSM-5 or also, you know, all sorts of issues, self-help groups. And so that's what I put together in the book, and I wrote it for community leaders. And I would say that every single one of you is a community leader. So you're a community leader in the school, but you're also maybe in the faith community. You may be in the community where you live. You may be involved in some elected office or some role with a county or state organization, but you're a leader. And if you're an individual as a parent, and you're a leader. So again, that's where this all can fit. And a lot of the insights as we go through this will fit there. This is a place where I work. This is Radford University. This is the Hurlburt Student Center. And this reminds me of why I've been involved in education for almost 50 years. We're investing in lifetimes. This is the sign over the entrance of the Student Center at Radford and Radford University. And it really is inspirational. And I hope that passes a message to you, maybe help you understand or remind yourself about why you're involved in this. So I'm going to organize the remarks in 3 broad segments. These are broad segments. First one will be competence, second will be confidence, and third will be commitment. And if I were testing you, as I did with students over the decades, I would get a little query about how competent you feel right now. And then, 10 or 15 minutes, hopefully that gets nudged up a bit. And then over time, you can work more and more on building your confidence. I'm sorry, your competence. And then we're going to go to confidence, and then we're going to go to commitment. Same sort of model, but I'm not going to do any testing today. All right, so let's look at competence. Competence is the skills. Competence is the knowledge. So first topic here, we have 6 quick topics: nature of concern. So what are we concerned about? We're concerned about the individual. So we have drug and alcohol use patterns, we have higher risk groups, we have reasons that people use, we have consequences, substance use disorders, and again, these are content areas in the book. And so as we gather information locally, and that's an important theme throughout this, what information can we gather that's locally appropriate, whether it's for my alma mater in Fairfax County, Virginia, or whether it's for the county as a whole, or Arlington County, or Loudoun, or Fauquier, something local. What's the local information? And then if it's in the home setting, what's the local information? Making it local. So gathering information, getting good knowledge. What is the reason people are using? I'm going to cite a study shortly that a colleague and I did at Mason. It's about teen drinking. And one part of that study, it gets into the individual why, is we did telephone polling around the country. This was 10 years ago. It's still valid today. The polling wouldn't be valid because a lot of people don't have landlines now. But when we did the telephone polling and we talked with parents and we talked with high school teenagers, and yes, we had human subject review from Mason, and we did not ask about their own use, but we asked about the messages they got. And we asked about teachers and we asked about parents and what messages are they hearing. And clearly what came out of that is the messages were top down. The messages were don't, and don't. Very few of the messages were here's what we want you to do. That's an important theme. You'll see that coming back again. But again, as we think about the individual concern, again, couple of the quotes. Some of you may know the name of the person listed here, Mark Gold. He coined the hotline, what, 35 years ago, 1-800-COCAINE. And so these are quotes that are from the interviews, and I think they just help remind us. Now, some of the quotes are going to be a little longer, so when you have the slides afterwards, you can scroll through them and say, I wonder what this means, or maybe we can get into some discussion, and this may be something that you talk about with people that you work with, or you reach out to those in your community, or even in the family. The second main thing is the nature of the concern is the environment around us. And some of the environment has to do with supply and demand. And it's the environment that helps promote drug and alcohol use, and it's the environment that holds us back from drug and alcohol use. I remember getting ready to do a talk years ago, maybe 6-7 years ago, and I called someone at the Drug Enforcement Agency, Drug Enforcement Administration, DEA. And I said, tell me something that is generally not in the news. And he said, you know, there's all these labs in Europe. These are his words. There's all these labs in Europe that are continuing inventing substances to meet the insatiable demand of the American public. Supply and demand. So if we cut off all the supply and we don't deal with demand, the demand is still there. That doesn't mean don't deal with supply. It means deal with both. But let's look at demand. Let's look at what's driving people to use drugs or alcohol. So one of the things that when we talk about the environment and we try to bring it local, here are some things that I offer as guiding principles. Again, this can be true in a school setting, in a faith community, in a community at large. But what's our societal context? I know Virginia's dealing with, and I'm part of a group now looking at marijuana and the legislation that's being proposed for the state. But what's the societal context today, and what's our needs? What are our current needs? It's important to have some good evidence about why you're going to do what you're going to do, not just take it off the shelf. There's some publications that talk about a best fit. I'll point you towards a federal agency shortly. And being creative, being comprehensive, use a variety of efforts. Policy alone will not do it. Education alone will not do it. Counseling alone will not do it. All of the above. Be organized, and then shared responsibilities, and we'll look at how to do that later. Helene White and talked about the progress we've made with drunk driving, and that's over the last 20, 30 years. We've made a lot of progress. Our society took that under its wings and did it. And so that's a major theme throughout today. It's called hope. We can make a difference if we want to. And I'm giving you a lot of clues along the way, and I'm going to point a little more aggressively later into some specific directions. So why should we be concerned? So why do I ask the question why? Well, what's critical here is that you find out what your own why is. Why should you be concerned? Why should you care? For me, it's about human potential. For me, it's about helping make the world a little better place. For me, it's moving us forward. For me, it's so much of these deaths and injuries and problems are preventable. We can do better. I do not want to do what I had to do 2 times in my professional career. The first one was physically, with one other squad from the emergency squad, carry out the body of an undergraduate student in my residence hall. No, they didn't have to run the lights and siren anymore because she was already dead. It was a drug overdose. And that was pretty formative for a 26, 27-year-old. Not too many years later, I was at Radford and had the tragedy of 2 of my 4 full-time professional staff were killed by a drunk driver on a Saturday afternoon when it was bright blue sky in October. And having to pick up my own pieces, and I still do. And it's decades later. They'd be retiring now. And I don't wish that on anybody, and that's preventable. So what is your why? And what's important in all this is we look at our root causes. And if you can see the mouse here, I'm going to come back to root causes, but this is what I call the percolate up model. And what this means is we need good organization. And this is more for, if you will, a community, or it could be a school. We need to have some organizational plan, get organized, some processes. We need good resources. Frankly, when I started in this work of drug and alcohol abuse prevention in 1975, the 2 federal agencies that I'll be citing very shortly were just founded a couple of years before. We need clear outcome. What sort of outcome do we want? Do we want no use? If we want no use, we will never get there. Sorry, we will never get to no use. Can we reduce problems? Absolutely. Can we reduce substance use disorders? Absolutely. Can we reduce a lot of the drunk driving crashes? Absolutely. Can we eliminate them? No, in my opinion. Harness the passion, that's where all of us come in. And I don't think we do a good job societally of that. And then root causes. And again, I'm going to come back to that. I want to paint a picture of the good ship Vasa. This was over in Stockholm Harbor, about 1500. King wanted the grandest ship ever. He wanted it, let's go test it and put the sails up and soldiers on the decks. And it went out into Stockholm Harbor and it flipped over. And it went to the bottom of the harbor where it stayed for centuries. It was brought up 20, 30 years ago. This is what it looks like in the museum today. I look forward to seeing it. So why do I share that? Because it was a tender ship. It was top heavy. Since it was top heavy, it flipped over. And so I share that here. The percolate up model is top heavy because we have a lot of this right here. And we're fuzzy here. We don't do well here. And we really don't address this well. So this is where I want to spend the next few slides and paint that picture. Root causes. So one way of slicing this, again, you can see the date here. This is 22 years old. I was part of a think tank. It was dealing with young adults. So the focus here with a lot of vision groups and think tanky things was how do we deal better with those root causes? And they went into these different guided discussions and came back and reported out, and bluntly, these 7 themes emerged. So here's the short version. It says, if people are more optimistic, they're less likely to become harmfully involved with drugs or alcohol. Think about optimism today in the midst of pandemic. If we're less optimistic, we are more likely to get involved with substances to deal with our lack of optimism. But optimism, hope. Values, a clear sense of what are our own guiding principles. What do we stand for? Self-care. That's skills of time management, stress management, exercise, nutrition, substance abuse monitoring. Relationship health is an important theme. That's connectedness with parents, with significant others, with friends, with coworkers, with supervisors. Community, a sense of community. Again, that can be in a work setting, in a classroom setting, even with Zoom. Nature, our connectedness with nature, and then service, the giving back. This was what came out as protective. This offsets the top down. Here's what I don't want you to do. And this is the bottom up. Here's what I do want to promote. This is consistent with resiliency skills. This, at Mason, we translated this. We got a national award for an exemplary program based on this. This is still alive, sitting on the website, and it takes those 7 themes and you can dive into each of them. And you see in the lower left, it's at the website compass.gmu. And if you go there today, every day is a different topic. We have 31 topics for potentially 31 days in a month. Today's topic happens to be generated, we selected them 8 years ago, self-responsibility. That's today's topic. You could dive a little deep in there and see some worksheets. The workbook is downloadable. And then how do you replicate that? But then here's the study I mentioned a bit ago that I did with a colleague at George Mason. And this was a national study about high school youth and alcohol. The context works with other drugs also. But we organize it this way. We're saying the teens world, if you look at this over on the left side, the teens world is what's in here. The underlying causes, and yes, there's slides to come, so hang on. Underlying causes and intrinsic factors. That's what the teen sees. And out here, the extrinsic and contextual factors is what we call them. That's what we're doing about it. So if you're a parent, if you're a teacher, you're a counselor, often you're not in their world, they are in their world. And we're trying to address their world with this, what's on the outside. So if you look at this, there's 2 slides, and you're going to need to go back into the slideshow, or also you can read the report where these resources are. Report is online on our George Mason University website. But if you look at the teens world over here, this is the center of the bullseye and the intrinsic factors. This is from them. And how did we get this? We got this from the telephone interviews. We got this from focus groups where we talked with teens in about 10 cities around the country and listened to them about what is going on in your life, what's important to you. Here are some of the intrinsic factors, not quite as deep. And then here's what we're dealing with. But we also wanted to, when we were writing this report, is to say, what helps to promote positive alcohol decisions? So again, you can see some of the same themes that you saw with Compass, and some of the themes that you've heard from various resources over time, the family bonds, feeling supported, listening, and then some of the things that are important, a little more extrinsic, okay? So reflections on why we should be concerned. B.J. McConnell, who worked for years with DARE. What could that person have accomplished had he quit smoking pot? We don't know. And then Tom Griffin, who worked for years up in Minnesota, Minnesota Institute of Public Health, trying to figure out where alcohol fits in our life. Turning to foundational factors and paradigms is the theme I want to highlight here. Here are 8 quick themes just to cause us to, if you will, rethink some of our frameworks, if you will. We can, first one here, and I've alluded to this, we will never solve drug and alcohol abuse. We will never solve it, but we can better manage it. So we change our frame of reference, then we can be more successful. Proximate outcomes, something more close by. Rather than, oh, we want to get to this endpoint in 30 years. Well, what can we do this week? What can we do this month? What can we do this year? Universal selective and indicated comes from the Institute of Medicine. It's a framework. This is the framework I've used in my most recent book that went to the publisher 8 days ago. And it's about college campuses in specific. Universal, what do we do for all? Selective is some subgroups, if you will. Targeted groups, and indicated is more individual based on a personal concern. Raise the bottom. Don't let things go all the way to the bottom. We can raise the bottom by not enabling, by calling the question earlier. Mission statements, our schools, our counties, our school systems, our states, our nation, we all have mission statements. How can we anchor ourselves with that? Promote versus prevent, that's the what do I want you to do versus what do I not want you to do. Clear messaging, I'll say more about that shortly. And then being positive and proactive, again, that is being hopeful. a couple of quotes. The Western framework of science, we love it, but it's not complete. And it's not wrong, but it's not complete. So there's a lot more that we have and that we can learn. A lot of that is qualitative. Everything does not have to be an experiment. I'm not talking about vaccines now. I'm talking about the tough work with our humans and with dealing with decisions about drugs and alcohol. Supply and demand, we've talked about a little bit. Public health, agent, host, and environment. And all of us are involved in that. So it's not just the health class, but all of us, and I'll paint that picture shortly. And we know drugs have a genetic basis. Why do some get harmfully involved and others don't? And they may be drinking or drugging in the same pattern. It's because of a lot that has to do with genetics and the environment. Intervention, treatment, and recovery. Again, in my classroom, I would spend hours and hours on this. There are books and books written on this. So we're not going to go into detail on that, but all of that is important. We need to intervene. If we see something, we need to say something. We hear that in other settings. We've had a lot of progress in recent years on treatment. We've had a lot more respect on recovery issues in recent years without a lot of the, if you will, a lot of the shaming or the stigma. And a lot of people do not understand addiction or what we call today substance use disorder. Prevention and education, again, lots of resources on that. A lot that has to do with risk and protective factors. That ties into resiliency that I've highlighted with COMPASS as well as the teen drinking report. And again, so much that we learn is through TV and movies, and a lot of that just isn't the whole story. And every single one of us knows a lot about drugs and alcohol from the lives of people around us. A lot of that is just not complete. And so learning from others, continuing to learn and to grow, the role of self-help groups, there's so much we can learn. I've gone to dozens of them. There are open self-help groups and closed. And that used to be a class assignment of mine, having students go to a couple open self-help groups. Prevention just societally has not taken the priority. And then we tend to focus on what's easy. And we need to be focused more on what's science grounded. Again, I'm not belaboring these quotes in the interest of time. So that's the first broad segment. That's about competence. That's our skills. That's our knowledge. That's getting good science grounding. And we can continue to grow. I'm going to point you to some resources shortly where you can get a lot of that information. 3 quick topics here under confidence. When we think about change and we think about doing better and doing different, I like to think in terms of force field analysis. I remember this from high school physics, but it's also in human and organizational theory. So here's where we are on whatever the issue is. And here up the higher black line is where we want to be. And the aim is to push that, I can't do it, but push this black line up, and our driving forces help. So with force field analysis, what we do is we try to increase these. We try to identify what will help move it forward, help propel it, and we try to negate or eliminate or reduce the influence of these. If you think of that as a simple concept, whether it's dealing with a son or daughter or a friend or a spouse or a coworker or the school setting or student or whatever, just think about what are their driving forces and what can help restrain that behavior. There's some planning guides. I'm going to show you 3 real quick. It doesn't matter, and I'm not going to belabor these. You can go read about them. It doesn't matter what sort of planning framework you have, just have something. So here's one from the federal government. This has recently been retooled by the DEA in a publication they published just less than a year ago. Here's one that I helped do at Mason. Again, it was a national project we had. So don't try to do it alone. You've heard the 13 guiding principles early on in this presentation. And again, prioritizing and ultimately institutionalizing, which we really haven't done a good job of in our prevention efforts. This is the framework I built for the book, the leadership book that I shared at the beginning. And then some reflections. A lot of this is about motion. We feel like we're doing something because we're doing something rather than we're moving things forward or we're moving the needle. And again, Mary Hill, very active in Texas and again, nationally. She had a problem and found a solution. Here's a planning grid. This was actually adapted from a school planning grid. So this is for colleges, and basically what it says, what you look at right here is a big poster. It's a big 2 by 3 foot poster. You can't read the words, but I'm showing you where the words are. So here across the top are 8 types of things that we do. We do training, we do curriculum, we do support services, we have rules and policies and so forth. And then we have a lot of who. This is for a college campus, but you can adapt it for a school, just like ours was adapted from schools. And so here's the who. And so what you have here is a row, like for example, student groups is right here, and they fill in all sorts of items here in the what categories. And so if we go into that, here are the specific items that schools are doing, and it's recreated on our website in a PDF document. You can't print out the big piece of paper, but all the content is there. But it's an idea generator, which basically says police have jobs besides enforcement, and counselors have jobs besides advising. All of us have a role across the board. So then you can take stock of what do we do, and this is like an idea generator. And again, lots of resources, lots of resources. Again, B.J. McConnell said, she thought enforcement was the answer, then education, then policy, then parents, and it's all of them. And that's the bottom line, it's all of them. Bill Modzelewski, who used to head up the drug-free schools unit in U.S. Department of Education, many, many employees there in his time. A Fairfax County resident. Thomasina Borkman talking about Al-Anon. But here are some resources, and I've shared several times. I'm going to point you to some resources. Here's some resources. SAMHSA, the Substance Abuse and Mental Health Services Administration, very active with all sorts of drug and alcohol issues. But here they have an initiative, you may have seen this, Talk, They Hear You. Again, check out the PSAs on their website. Or you have here with the DEA, Getting Smart About Drugs, lots of information. And this was always my go-to resource when I heard about a drug, some new drug hitting the street, I would go check it out, learn more about there. Or the National Institute of Alcohol Abuse and Alcoholism. You want to talk about different issues of alcohol and how it affects health, or some of the basics, right there. And again, same for its parallel agency on drug abuse. And these are just some of the resources. Again, going back to SAMHSA, there's lots of resources about reaching young adults, how do parents get involved. The Foundation for Advancing Alcohol Responsibility, advice on parenting teens, and CADCA, Anti-Drug Coalition of America. Again, lots of resources, lots of opportunities. That's all that from the Percolate Up model, that's a lot of what's at the top. And then some communications foundations before we go to our last segment. So communications foundations, when you're communicating, what is it that you want your audience to know, feel, or do? You're doing a webinar, you're doing an educational session, you're writing an article, you're doing an op-ed piece, you're being interviewed for the newspaper or the local newsletter. What do you want the audience to know, feel, and or do? What I want for you is for your confidence to go up, your competence to go up, your commitment to go up, even just a smidgen. I want you to take a look at these slides afterwards and go to some of those URLs that might pique your interest. And then I want you to share those with others. So here's a couple of things that this is going to fill one of those objectives that talked about skills. Again, I say a lot more about this in this book and another book that I'll highlight. But here are some examples of tools and resources that help with communication. And I'm going to do real quick insights on 3 of these that I've listed with the arrow. Okay? So creative epidemiology. Epidemiology is all those statistics. It's all those numbers. And you recreate it in a way that people understand. I heard a newscaster last night say, if we did like we read all the names for 9/11, if we did that with the same cadence for everyone who has died, from COVID. It would take a week. That's creative epi. So again, here's a few examples. Filling 1,000 tractor trailers. What it does is it takes those mind-numbing statistics and brings them to life in a visceral way that you feel in your heart. Social norms marketing is correcting misperceptions by showing what the majority in fact do. We know that people do not have good estimates of what others are doing. They overestimate negative behavior, when in fact, the majority are doing positive behavior on a lot of health issues. So here's a couple examples from their own local data. And you feed that back because people assume, well, everyone's doing it. Everyone's doing it. I remember a study in Virginia, statewide college, when ecstasy was coming in, and the perceptions from students was that 90% were using ecstasy, and the reality was that 8% have even experimented with it in their lifetime. It was totally off. People were misperceiving, and that's common. So correcting misperceptions is called social norms marketing. Linking and pairing, let's link it to something else. If I'm doing a letter to the editor, an op-ed, I'm going to link it to something seasonal or some image or making some comparisons. This helps to get greater power. So this one person said, well, air pollution is the new tobacco, because we know so much about tobacco and made a lot of progress with tobacco issues, so air pollution. Or linking it to a national month or a week. These happen to be months. Or how about today, September 22nd? What happened today? Now, if for some reason some of your initiative had to do with Switzerland or being independent, you might say, well, I'm going to link it to Switzerland because that happened on this day. Or Abraham Lincoln issued a preliminary Emancipation Proclamation. Or if you're like us, we love theater in New York City. We love theater anywhere and look forward to getting back. But that happened on this day, the Music Box Theater opened. Or the 4-level. We see so many of those in Northern Virginia. Those are those big interchanges. It's like, oh my gosh, how are we going to figure out how to do this? Or John Kennedy signed the Peace Corps legislation on this date 4 decades ago. A concert in Champaign or Friends debuts. Anyway, finding some linkage. And again, this is highlighted in a book that I did with a colleague about 4 years ago. Some reflections here. Again, thinking about our drug and alcohol issues as a marketing issue. And then marketing it to the young people and getting them involved with our messaging as we're going to reach other young people. So as I move to the last segment here in our last 5 minutes, I think about the pyramid of success and I'm going to look at commitment. Leadership. The point of leadership is all of us can be leaders. We don't have to be elected. We don't have to be appointed. We don't have to be named chairperson or president or mayor. We can be leaders. We can be natural leaders. Again, you can do this in the family. And leadership doesn't mean having all the answers. There's all sorts of models of leadership. Here are some book titles of leadership. All sorts of different titles. There's no magic answer. There's no magic answer. I mean, servant leadership, what does that mean? Or excellence, or the 8-point, or the 7 habits, 8-point plan, 7 habits, or authentic. What does that mean? So we can all be leaders. There's all sorts of strategies that will help us to be leaders. And then if you happen to be in a leadership position, particularly if you're respected, you might position yourself, one of those communication strategies, because you're the longest serving person. You've been the teacher for the longest number of years. You've endured 6 principals in that school or whatever. But then working with the peers, working with student advocates, the student voice, that is so important and so helpful. A whole different theme is believing in yourself. What does that mean? Well, that's part of commitment, that keeping at it, that's tied into confidence, but it's also commitment. It means having balance. These are opium scales. This is a photograph I took in the Hall of Opium Museum Yes, I took that photo. And yes, those are opium scales. No, that was behind glass too. But the point is, it's showing balance. And how do you find the balance in your life or the legacy? One of the things I would start all my classes with at George Mason was legacy. And I would say, what do you remember about your grandfather? What do you remember about your grandmother or your great-grandparent? What do you remember? And people would say this or that. And then I would say, well, let's translate that a little bit different. If you're going to have children or grandchildren, what are they going to remember about you? What are people around you going to remember about you? What are they going to remember about you when you're gone? What legacy are you going to leave? I would have students write that out. What legacy are you going to leave? What do you want to leave? Now, it doesn't mean that that's the legacy they're going to remember. But if you're more intentional about the legacy that you aspire to, you're more likely to get there. And so thinking about legacy, thinking about what's your why, what is your why in this, how do you want to be remembered, then you can be more intentional towards that. Part of that, believing yourself, is having systems so that you support one another. That helps to sustain you. And that's part of that commitment. Because again, the work in drugs and alcohol is hard work. And last but not least, before I wrap this up, is our vision for the future. This is something called the Festus disc. You can see how old it is. I happen to wear one around my neck. It's not the original is quite large. So I wear a replica from a visit to Greece during my 50th birthday celebration. Because I loved it, because it hasn't been translated. And why is that interesting? For me, it's interesting because a lot of this work with drugs and alcohol is not translated. A lot of it is. We know a lot. We know so much more than we knew 10 years ago, 20 years ago, 30 years ago. But we're still on the path to discovery. And each of you is part of that road. Each of you is on that path. Each of you can draw these insights from the various people that I interviewed. Someone like Bill Kane up in New Jersey, who oversees the lawyer's assistance program in New Jersey. Every state has a lawyer's assistance program to help the lawyers with drug and alcohol issues. And he founded the judge's assistance program. Think about that for a little bit. And so he said, when I interviewed him, it's important for people working in this field to never give up. And so it's not just the people working full time, but the people who have passion like you, to never give up, never give up. And that's the case for individuals and programs. So keep at it, keep at it. So my intent today was to look at competence, which is your skill. Your confidence is your belief in yourself. Your commitment, which is your willingness to go the extra mile. Because we need to go the extra mile or 2 or 3 or 4. The objectives, looking at each of these components and how they can apply to your personal and professional efforts, some increased resiliency, and then a few little skills, a few little skill sets. So that's where I set out. My contact information is here. You're welcome to use it. You're welcome to follow up. I know we have questions, and I'm going to rely on one of the hosts to read the questions, because I saw, as we were going through this, I saw 30 notes in the chat box. I did not look at a single one. So I'll turn it back over, I think, to Shelby.
Yes, thank you so much, David. That was such a wonderful presentation, and I know that everyone has gotten some great strategies out of there. I have a question for you, actually specifically on a strategy, and I actually want to expand on it. So the question was, how can I as a parent understand how to model resiliency for my family? But I think if you could also answer that question for maybe somebody in a managerial role, especially in this virtual environment that we're all in, how can you model resiliency when you are trying to do that through a screen?
It's hard, be honest. You know, I think we all have to find our own way of dealing with this, you know, and so the lens that all of us have right now is the COVID lens. I mean, that's our lens. And it's hard. So when we have that, we all have to find our own way to cope, whether it's taking a walk or putting on headphones. And for me, a lot of it is, yes, I'm emeritus. So I'm not teaching the classes, but I'm still writing and I'm still sharing and I'm still getting inspired and motivated. But I think it's also important in terms of how do you model resiliency is when you're not feeling particularly resilient. Two things come to mind for me is that is share that where you feel safe to share that. It might be your significant other, it might be your best friend, it might be a coworker, but share like, I'm grasping right now, or I'm drowning right now. So find that place for support and then share that with others. You may say it in a little different way. You may just say, this is a particularly hard day for me. It's a hard day for me. And so, you know, to me, if you go, when I shared compass and the pyramid of success, not the pyramid of success, the life health pyramid, the life health model, starting with optimism, value, self-care, relationship health. So this is where we need relationships even more than ever. You know, sometimes with some of my colleagues, some of the task forces that I'm on, I'll send a little quote or I'll send a little image that I found, you know, whether it's an apple or a tree or something. It's like, oh, we needed that little pick-me-up. So finding those little ways to do that. So again, listening to yourself. You know, when 9/11 happened, I was on the board in Arlington, Community Services Board in Arlington, Virginia. And Community Services Board, there may be some online here, and the Community Services Board deals with mental health and mental retardation and substance abuse services. But mental health, and so what is normal? What is normal in 9/11? And so to say we don't know what normal is, we're not quite sure. So dealing with mental health, but to talk about that and talk that through. I remember Arlington hired 50, 55 counselors pretty much right away to try to deal with resiliency in the community. So talking it through, listening to yourself, finding your own way to cope, and if it's a particularly hard time, share that with others. Find your place where you can get your own booster shot. And try to be preventative, but just be honest. To me, that's and then when we get to the other side of this, whatever our world will be looking like in terms of resiliency, again, I think the same answer still applies. I think it's universal. It's not about COVID. It's just about our world and just how do you manage? Just be honest. And I think that deals with parents. You know, being honest. You know. Your father's having a bad day, your mother's having a bad day, or you know, whomever's having a bad day, or this is just not a good time. Let's just save that for another day, and we'll get to that. I hope that's helpful to whomever asked that, but that's a good question. It's a hard one.
Thank you so much. I'm going to throw another double whammy at you.
Double fine.
So I have one question that says, if you had to tell parents one thing about how to best support their children regarding alcohol use, especially with the peer pressure to use, what would you say? But the second half that I'm adding on to that question is, I think there's, you know, somewhat of almost a social peer pressure for adults, especially during this time of COVID for, you know, I'm at home, I'm gonna drink this quarantini, or, you know, I'm just gonna have another glass of wine. And it's almost like you see your friends drinking the wine on Zoom, so you wanna do it too. So it's kind of a different version of peer pressure. I don't know if you can speak to both of those for the how to have the parents support their children with that, and then also as an adult dealing with that pressure as well.
Yeah, there's no magic answer. There's no magic answer. But the bottom line in dealing with kids is listen. Listen, listen, listen. If you go read the report. Yes, it's 10 years old, but it's still valid. It's hard. It's a hard-hitting report that we shared on teen drinking cultures. But what it says is, look at what's core and what's key to the young person. And it's not just about alcohol. It's about marijuana. It's about other illicit drugs. So listen to what's going on in their lives. And so it's not just listen in a reactive way, like, you're 15 years old, but do it at a proactive way, like you're 8 and you're 9 and you're 10 and you're 11, you're 12, all the way through. Listen, support, try to understand, try to get into their world. It is hard. I mean, Gen Z, who are older than the early teens of today, I mean, the Gen Z that we're trying to reach now, like in the college level, is different than Gen X. So reaching Gen Z, and then thinking about our 12-year-old, what's a 12-year-old is going on 18. So try to get into their world and listen and accept and support. That doesn't mean always supporting all the decisions. Like, I don't like that decision, but I support you as a human being as you're struggling with all of this and you're struggling with peer pressure. Also remembering that so much of what they are hearing from their peers is not what in fact the peers are doing. So peers may say they're doing something when in fact they're not. So that's some grandstanding stuff. In terms of their own, it's making conscious choices. And it's like, why do I want this drink? I mean, why do I want this drink? Why do I choose this drink today? Because I want, this is called water, Why do I want this? It's to nourish, it's to stay refreshed. So making a conscious choice, trying to limit, knowing that the stressors are there, the ambiguity about the future is there, the social unrest that goes beyond COVID is there. We have so much that we as a US society and the world cultures are dealing with. It's hard, but it's by talking about it, by finding places that we can learn more, finding our own support, and finding ways that we can make our own little pieces of difference. So again, knowing that these are just hard times, and have the faith, have the hope to get us through. If we don't have that hope or some faith in a better tomorrow, and that's why optimism was the core base when you look at that life health pyramid, which was the basis of Compass. If we don't have that optimism or hope, what do we have?
All right, I actually have a follow-up question for you with regards to being in the situation as a parent. What do you do if your child doesn't want to talk? Do you have any conversation starters?
When I pointed to those websites, responsibility.org, the DEA website, the National Institute on Drug Abuse website, those all have good conversation starters. So but I don't think there's any magic answer. Again, look there. When I think of a conversation starter, it's like, well, is there another adult? Would you feel comfortable talking with so-and-so, our next door neighbor? I know that I, as a teen, when I needed to talk with somebody, I knew which neighbor I would be talking with. What little did I realize that probably 5 minutes after I left talking with that neighbor had already talked to my mother. But that's okay. But that was a safe place to go, and a safe place to, unwind and share a different perspective and get a different perspective. Because often young people don't want to hear from their own parent, but they'll listen, their uncle, their aunt, maybe their teacher, their guidance counselor, maybe there's a community police officer or someone in the faith community. There's all sorts of people that, just ask. There's someone that you trust that you would like to talk with, because we can arrange that. I'll drive you there.
That's some really great advice. And I think that's definitely some advice that everyone can take to heart, that just asking, especially now in this time of COVID and unrest. I think people are learning that they need to lean on each other a little bit more, maybe lean into some outlets that maybe they wouldn't have before, but you don't know what skill sets other people have or who they know that might be able to connect you with someone to get you, in a pod for your child, or just to, ask a question to or be a resource for their child.
Yeah, if I can jump in, because I know you're going to
Sure.
cut off. I just want to put a quote out there just to kind of wrap up what you were just saying, Shelby, and some of these questions. And this comes from Gandhi, who said, I am a dreamer. So you can think about your vision, think about your legacy. But Gandhi said, I am a dreamer. I am indeed a practical dreamer. I do not dream of useless nothings. Insofar as possible, I convert my dreams into reality. And so I offer that because, you know, what I shared today isn't the answer. It's meant as a stimulus. And a lot of the questions that are asked and a lot of what people are already doing, this is great, but it's, you know, amp it up a little bit and maybe go in some different directions. And again, rely on a lot of the resources that I pointed to you, particularly those 3 slides in the middle with the couple of 4 federal agencies and 2 other national organizations. I think that those are the go-to places. That's where I go. That's where I still go and look for the latest information. But again, I'm a dreamer. I'm indeed a practical dreamer. I do not dream of useless nothings. Insofar as possible, I convert my dreams into reality. And this is all important work that we're doing and all that you're doing. So I applaud you for that. So do you have another question?
I'm going to try to squeeze one last question in there really quick.
Great, thank you so much.
So this one is, again, going to relate to resiliency. How
Good.
do you communicate to your supervisor that the demanding schedule is one of the main causes of excessive stress right now, and it's not the employee who needs therapy instead of it's not the employee that needs therapy, you know, looking to treat the source of the problem versus the person?
Yeah, there's a little bit of blame in there. So to me, it's all of this is a shared responsibility. How are we going to get through this together? And then what's it going to look like on the other side? You know, how are we going to get through this together? And, you know, we as an organization, whatever it is, you know, we're doing a lot with Zoom today. We have a lot of stress. We're going to have to start talking about what the transition is going to be like as we go back to face-to-face, as we just figure out ways of doing that safely. And what's that going to look like? And what's the new model going to look like in 6 months, in a year, in 2 years? So the answer is shared responsibility. Problem solved together. Let's come at this together. Yes, one person is a supervisor, one is a supervisee, but we are sharing this together and we've got to figure this out together.
All right, thank you so much, David, for being our speaker today, giving us your time and your talent, and to share all your knowledge that you have. Like we said earlier, we will be sending out those slides and the links to all of the recordings at the conclusion of the entire webinar series. For more information on the remaining webinars or for resources on substance abuse and addiction, please visit actonaddictionnow.org. We're also putting this link in the chat so that you can copy and paste it. For our audience in the 8th to 12th grades, or if you know anybody in those grades, Our Minds Matter is hosting a mindfulness workshop tomorrow, Wednesday, September 23rd from 4 to 5 p.m. There is a separate registration link for that you can find on the Act on Addiction Now website as well. Our next adult focus webinar will be the use of telehealth for substance use disorder treatment with Dr. Sulman Aziz Mirza on Thursday, September 24th from 5 to 6 p.m. There'll be a link to register for that webinar in the chat as well. We would be so appreciative if you could also take our survey. The link is going to be put in the chat and it should also pop up on your screen once the Zoom closes. This will help us evaluate our sessions for this year and provide vital information to shape next year's conference, whether virtual or in person. Thank you all so much for joining us today, and we hope to see you at the next webinar.